A group of doctors, nurses, and other stakeholders are calling for a change in leadership at South County Hospital and raising concerns about the future of the 100-bed facility.
Target 12 investigators have been working on this story now for a couple of weeks, and we are joined right now by Tim White and Eli Sherman.
Eli, the issues at South County Hospital were pushed into the spotlight last month when most of the facility's cancer doctors decided to leave. Now more turbulence with an open letter this week signed by some employees and others.
Yeah, Tim, that's right. Dozens of people signed this letter, and they expressed concerns over the hospital's lack of primary care physicians, staffing shortages in the cardiology department, and a massive backlog of patients waiting for some services. They also say that these are issues that should be both a concern for patients along with the broader South County community.
And that letter also complained about the management style of the hospital's leader, CEO Aaron Robinson. In the letter, they called him, quote, abrupt, callous, and confrontational.
Tim, there's a lot of tension there. Last week, I sat down with Robinson and board chairman Joseph Matthews, and I asked the CEO if he's a tough person to work for. Here's what he had to say.
No, not at all. I think sometimes I have to make tough decisions. And I think, unfortunately, we as a small subscale health system in an under-reimbursed state that has many, many challenges, we have to make Sophie's choices on an ongoing basis. And sometimes those decisions are unpopular.
Now, Tim, the hospital leaders told me a lot of the hospital's problems for them is actually financial and not management. So last year, the hospital reported having losses of more than $6 million. And South County is facing some of the same strains as other hospitals, which is that the state doesn't get reimbursed at the same level as some of the neighboring states, Massachusetts and Connecticut.
All right, so Eli, for our viewers in South County watching this, they may be wondering if there is a risk to the hospital, which, I mean, needless to say, is vital to healthcare in the region. Is there a risk it could close?
If you ask leadership, they say absolutely not. Some of these doctors who are very concerned say if there aren't changes in management and how the hospital is being run, that the hospital may die.
All right, well, it's an important story, obviously, and we have more details from that letter and the CAO's response to Eli Sherman right now on WPRI.com. Eli Sherman, thank you very much.
Great to be here.